This week, the state is holding the first of 5 input meetings for the Rural Health Transformation Program grant in Yankton. The state hoping to receive upwards of $200 million from that grant every year for the next 5 years.
Grant Green brings us continuing coverage on the healthcare needs that were identified as good uses of that money.
Stacy Ondernacht with Feeding South Dakota says whether it's providing food or health care, distances can be hard to overcome, but there is plenty of room to grow.
A lot of the challenges in the healthcare world are the same as in the food insecurity world. Transportation being a really big part of it. In a rural state, when the nearest grocery store is 40 miles away and you don't have a vehicle to get there, that makes you food insecure. It also makes medical access hard as well.
Responses ranged far and wide, including a gap in behavioral health facilities up and down central South Dakota, an exodus of pharmacies, and increased support for pregnant women struggling with addiction.
The best opportunity we have is to look at who's already doing these things, who's already, getting into these places, where do we already have a presence that would be not very expensive to expand into the next area of need, whether that be into the next county or the next community.
Brock Robs, the executive director of the South Dakota Health Occupation Students of America, says investment into health education grants can go a long way to helping a student making career decisions and decide to work in a small town.
They'll think more about, growing up, when they can reflect, it's like I really had a great upbringing in Kadoka or Iroquois or Fulton, and now I've got a family, and I know I've got opportunities there in healthcare to work, something that they might not realize yet.
Robs says there is a lot of value in working in a small town for these aspiring students.
It's not instantaneous. It just takes time, right, to do some of these things. And so you can't necessarily graduate and get into your dream career making a 6-figure income. That stuff takes time.
There are 4 more of these meetings that will last through the month of October, and then the Governor's Office, Department of Social Services, and Department of Health will help put together an application that needs to be submitted by November 5th. In Yankton, Grant Green, Dakota News Now.